Well, good afternoon, everyone. Welcome to this webinar, Our Planet, Our Health, Our Public Health Responsibility. We are excited to actually be the opening webinar for Canada Public Health Week, which is a new celebration instituted by public health associations across Canada to increase recognition of and appreciation for public health services, competencies, and public health issues. It's my privilege to speak to you today from the traditional territory of the Lekwungen-speaking people, the Songhees and Esquimalt First Nations. I'd like to begin also by saying thank you to CPHA for helping to convene this webinar. I know we have registration from across the country, and that was indeed our hope. I'd like to suggest that as we proceed, you're welcome to make comments in the chat throughout the presentation. It'll be about 40 minutes in length, and also to post your questions and answers in the Q&A section, and we'll address them following the presentation. And it is, I think, very important that we address this topic today with one of the leaders of the environmental and green movement in Canada, and one of the most significant voices on this internationally, Dr. Trevor Hancock. Yesterday, the Intergovernmental Panel on Climate Change produced its report, which was introduced by the leadership of the UN, calling for a focused, committed, and action-oriented response for all member states globally. So our timing, I think, for this could not be more important. So now I'm going to turn and introduce my longtime friend, Dr. Trevor Hancock. Many of you will already know him as a public health physician and health promotion consultant. He retired in 2018 from his role as professor and senior scholar at the School of Public Health and Social Policy at the University of Victoria. He's one of the founders of the Global Healthy Cities and Communities movement and co-founded both the Canadian Association of Physicians for the Environment and the Canadian Coalition for Green Healthcare. And let me just say that the Public Health Association of BC, which has organized this talk as part of Canada Public Health Week, is an active partner in both of those coalitions. Trevor was the first leader of the Green Party of Canada in the 1980s and led a 2015 Canadian Public Health Association task force on the ecological determinants of health. And I want to mention that particularly because as public health members and providers, if you look to that report, you'll see very specific and clear recommendations for action that public health can engage in. His most recent focus has been the combination of his two main areas, the relationship between human health and the natural environment, and linking the healthy and sustainability community approaches through the concept of a one planet region. In retirement, he started a new NGO, Conversations for a One Planet Region, to explore and popularize these ideas locally. He was made an honorary fellow in the UK's Faculty of Public Health in 2015, and in 2017 was awarded the De Vries Medal, CPHA's highest award, presented for outstanding contributions in the broad field of public health. Trevor has been an activist for nature all his life, and we're really blessed to hear from him today. Over to you, Trevor.
Well, thank you, Shannon, and good morning, good afternoon, perhaps even good evening to all of you. I'm Trevor Hancock, and I'm proud to be speaking to you from the unceded or improperly ceded traditional territories of the Lekwungen-speaking peoples, which is here in Victoria, BC. I'm going to talk about the topic right here, and what has, of course, triggered that topic and triggered Public Health Week for that matter, and likewise I'm grateful to CPHA for that, is that World Health Day, which is on Thursday of this week, is on the theme of our planet, our health. And so that is going to be the focus of this presentation. And in talking about that, WHO has said that it wants to focus global attention on urgent actions that are needed to do two things: keep humans and the planet healthy and foster a movement to create societies focused on well-being. And those two are the themes that frame my presentation today. So I'm going to begin by talking about the Anthropocene and the challenges we face. And it's more than just climate change, as I'll talk about. Then I'm going to touch on the health impacts, which are considerable. And then I want to end by talking about both a well-being society and what that means, and what we need to do in terms of some governance innovations societally, in the health sector, and at the community level. So let me start with the Anthropocene. This is a very powerful statement from Antonio Guterres, the UN Secretary General, about almost 18 months ago now. He has been, incidentally, very strong and very powerful on these issues for the last couple of years or more. The state of the planet is broken. Humanity is waging war on nature. This is suicidal, he said. Powerful statement, but a really accurate statement, sadly. And of course, a lot of our attention focuses on climate change. Many of you will know about the observed change in surface temperature, the increase in CO2 emissions, the changes in Arctic summer sea ice and global sea level, and so on. We know all about that, or at least we know a great deal about that. And we just had, as Shannon said, a new IPCC report coming out saying that we're in real danger of blowing past 1.5 and even past 2 degrees centigrade increase in global warming, which is going to be very dramatic indeed and very damaging to health and to society. And of course, WHO, which attended the COP26 Global Climate Summit in Glasgow in October, released the report then, a special report on climate change and health, and said, as they have been saying regularly since 2008, in fact, that climate change is the single biggest health threat facing humanity. And they went on to say that it threatens to undo the last 50 years of progress in development, global health and poverty reduction, and further widen existing health inequalities, both between and within populations. So this is very dramatic, but it's more than that. And in fact, it's worse than that. So I want to talk to you today in the context of the Anthropocene. Some of you, perhaps all of you, I hope, are familiar with the term, but this is a new geological epoch that has been proposed and in fact has been essentially verified by the International Stratigraphic Commission's Global Working Group on the Anthropocene back a couple of years ago now. But the Anthropocene is three things. First of all, it's a geological phenomenon, which is why the International Stratigraphic Commission gets involved in, if you like, certifying it. It's a new geological epoch. We have moved out of the Holocene from the last 11,000 years into the Anthropocene. But the layers of rock and minerals and materials, things like plastic and concrete and radioactive, long-lived radioactive particles and higher levels of CO2, for that matter, that are being laid down in the rocks, represent what is really an underlying ecological phenomenon, which is massive and rapid global ecological change, which is being laid down in those layers for future generations to see and find. But behind all of that, it is, of course, a human phenomenon. The very word anthropos refers to humans. It's the ancient Greek term for humans. And the Anthropocene is a human phenomenon, but more precisely, some of us are the anthropos in the Anthropocene. Some of us, those of us in high-income countries, have a much larger impact than people in low-income countries. And of course, it's more than just climate change. And if you read our CPHA report that Shannon referred to from 2015, you'll see we identified the issues that you see here. So in addition to climate change and ocean acidification, which is a consequence of CO2 emissions, we're looking at ozone layer depletion, and that's the only place where there's good news, by the way. We are slowly repairing that depletion, but there's renewable and non-renewable resource depletion, pollution and ecotoxicity, which is the contamination of food chains. And of course, remember, we're part of food chains. We sit at the top of a lot of them. Contamination of food chains with persistent organic pollutants and heavy metals. And finally, and in a sense, the summation of all of that, species extinctions. And all of these are happening at the same time. And so together, This constitutes what many people are beginning to be concerned about. This constitutes an existential challenge to certainly society, if not to humanity itself. So this is the context in which I want to talk to you today. What makes the Anthropocene so scary, frankly, is it is both the scale and the rapidity of change that matters. We're crossing planetary boundaries. This is famous work from 2015 that identified a set of natural systems which are around the outside there, like climate change and novel entities such as persistent organic pollutants and heavy metals, stratospheric ozone depletion, and so on. And there are a set of these planetary boundaries where they estimate what the safe operating space, as they refer to it, is for humanity. We've already passed the safe operating space, the planetary boundary for biosphere integrity and for biogeochemical flows. We're approaching it for land system change and climate change, and beginning to get there for ocean acidification. And that's quite old data. It's worse than that by now. So we're crossing planetary boundaries. We are decimating vertebrates. So this is from the 2020 Living Planet report from the World Wildlife Fund. There has been a 68% decline since 1970 in the average abundance of 20,000 or more populations of vertebrate species monitored across the globe. And so that is what underlies the notion of a sixth great extinction that we are causing. And all of this is driven by three powerful forces. So global GDP grew 11-fold since 1950 to well over $100 trillion and these are in standard dollars, in 2016. Now, interestingly enough, 1950 is approximately when I was born. I was born in 1948. So all of this has happened in my lifetime. Global GDP grew 11-fold, population growth grew 3-fold, and the power of our technology also increased immensely. And so it is these three factors that are driving these massive and rapid ecological changes, and they are rapid. This is a set of charts from the same group, the Stockholm Resilience Institute that Will Stephan and his colleagues are part of, that shows both socioeconomic trends and Earth system trends over the last couple of hundred years. But what's really important is the dotted line in each chart, marked by the red arrow, is 1950. And 1950 is the proposed start date for the Anthropocene. And you can see the dramatic kick up, for example, on the left there, top center, real GDP. You can see the 11-fold increase I was talking about. You can see population growth. You can see all of these things kicking up very much since the 1950s. And you can see the impacts on Earth systems also since the 1950s on the right. So this is the situation we're facing. And as a result, we're exceeding Earth's biocapacity. We have actually increased our ecological footprint, almost doubled it since 1970. And we now are using almost 2 planets worth of biocapacity annually, which of course is completely unsustainable. And note that more than half of this is carbon. And yet, let's face it, this is the reality. This is what it's all about. Never mind what Elon Musk may fantasize about. This is the reality, that we have just this one small planet that is our home. But in Canada, we act as if we had this. Our ecological footprint is around, or getting on for, 5 planets worth of biocapacity. And that was from data from 2016. So if the rest of the world lived the way we live, then we're going to need to find another 4 planets. And obviously they're not out there. So the consequence is we're going to have to get down to what I would call, and many others are calling, a one planet Canada. That is to say, a Canada with an ecological footprint equivalent to 1 planet's worth, not 5 planets worth. And that's going to require a quite dramatic and rapid reduction in our ecological footprint by 70 to 80%, a good chunk of which, remember, is carbon. And that would get us to, and this is where the equity issue comes in, what should be our fair share. We are currently taking way more than our fair share of the Earth's biocapacity and resources. And in doing so, we're making it hard for not only other people, but other species to get their fair share, which is part of why we're driving those other species into extinction. So that's the reality of the global context we face, the Anthropocene. I know it's depressing, but I often make the analogy that it's like having a diagnosis of cancer. We don't ignore it. We don't pretend it's not there. We don't fail to tell the patient that they have cancer. Well, we need to look upon this in much the same light. You can't deal with this extraordinary challenge if you don't, first of all, recognize that it's there and that it is an extraordinary challenge we have to face. And whether we're talking climate change or the much wider set of issues I've just posed, they are dramatic, they are rapid, they have to be addressed, and we have to face up to them and deal with them. And of course, they have health impacts. So Shannon referred to this report from 2015, which is both a discussion paper on the left and a background 100-page document on the right. And what we were looking at was what we called the ecological determinants of health, which was a conscious choice to try and rebalance, not to replace, but to rebalance the ecological and the social. So we didn't want to replace the social determinants of health, but we need to understand that there are both ecological and social determinants. They in fact interact, and we need an eco-social approach to addressing our challenges. And those ecological determinants are the ecosystems on which we depend for the very stuff of life. So air, water, and food all come from nature. So do all of our fuels and all of our materials. Nature protects us through the ozone layer from UV radiation. It recycles and detoxifies our wastes. And for the last 11,000 years, during which what we've called civilization and agriculture have emerged, we've had a relatively stable and livable climate, which is clearly no longer the case. And if you read the language around the latest IPCC report, you'll understand just how dramatic a challenge we face. At the same time as we were doing our report, the Rockefeller Foundation and the Lancet were putting together had put together a commission and were doing a report on safeguarding human health in the Anthropocene. And they focused on what the Lancet had called Planetary Health, which is the health of human civilization and the state of the natural systems on which it depends. Note that, on which it depends. So civilization and health depend on those natural systems. More recently, again, Antonio Guterres, in a report to the UN General Assembly in September of last year, Our Common Agenda, defined the triple crisis of climate disruption, biodiversity loss, and pollution destroying our planet. And obviously, that is a health threat too. And in a subsequent, or in an earlier report rather, from the UN Environment Programme in February of last year, so just over a year ago, a report called Making Peace with Nature, they brought together the evidence of the impacts of climate change, the biodiversity crisis, and pollution that kills millions of people every year. In fact, WHO estimates about 13 million people a year, and that's undoubtedly an underestimate. So this is a massive health impact. And in that report, the UN Environment Programme said that the risks to human well-being in the achievement of the Sustainable Development Goals will continue to escalate until degradation is halted, environmental degradation. Global warming, loss of biodiversity, and increasing pollution will likely have dire consequences for humanity. This makes this very much a public health issue, which is obviously why we're doing this webinar today and why I'm talking to you. Now, undoubtedly, and I've already touched on this, climate change is a massive threat with massive health implications. An editorial in September 2021 in the Lancet and 230 other leading medical journals around the world described the continued failure of world leaders to keep global temperature rise below 1.5 degrees C and to restore nature, described all of that as the greatest threat to global public health. So if you, like me, work in public health, and I assume if you're here that you do work in public health, this is the greatest threat we face, the greatest challenge we have to address. And it also has massive equity implications. WHO, in its special report, noted that the people whose health is being harmed first and worst by the climate crisis are the people who contribute least to its causes and who are least able to protect themselves and their families against it. People in low income and disadvantaged countries and communities. So we need to be very aware of the health impacts and the inequity impacts. I've touched on pollution too. The Lancet Commission on Pollution and Health in 2017 estimated there were 9 million premature deaths in 2015, 16% of all deaths worldwide from pollution. And note that this is 3 times more deaths than from AIDS, tuberculosis, and malaria combined, 3 of our most prominent infectious disease causes of death, and 15 times more than from all wars and other forms of violence. Although sadly it seems Mr. Putin is trying to threaten that, but that's another topic for another day. But the point is we underestimate the impact of pollution. And moreover, that report noted that it disproportionately kills the poor and the vulnerable. Nearly 92% of pollution-related deaths occur in low-income and middle-income countries. And in countries at every income level, disease caused by pollution is most prevalent among minorities and the marginalized. So whenever we're talking about whether it's climate change or pollution or biodiversity, which is the topic of this slide, it remains the fact that there are not only health impacts, but there are inequitable health impacts everywhere. So this comes from that same UNEP report on making peace with nature, that biodiversity loss poses risks to food production. It threatens nature's ability to support human health through regulation of air and water quality, and biodiversity loss is increasingly negatively affecting nature's ability to supply medicines. So I'm not going to keep beating the drum on the health impacts of massive and rapid global ecological change. It should be very clear, as WHO's World Health Day theme very clearly puts it, that it's our planet, our health. So that is the challenge. That is the problem. What do we do about it? Well, WHO not only has made our planet, our health the theme of World Health Day, it also in December 2021, so just 4 months ago, created the Geneva Declaration on Wellbeing, which came out of the 10th Global Conference on Health Promotion. So I want to now focus on what WHO is suggesting, and you'll remember that the second point in my opening slide from WHO was they want us to focus both on the challenges of being a healthy planet and on what it takes to become what they call a well-being society. And I'm going to talk about 3 broad areas that you see there, which are 3 of the 5 key strategies in the Geneva Charter, not declaration, sorry, the Geneva Charter for Wellbeing. So the Geneva Charter, and this is taken from the Charter, expresses the urgency of creating sustainable well-being societies committed to achieving equitable health now and for future generations. We do need to keep future generations very much in mind without breaching ecological limits. So here you have it in a nutshell. We're talking about sustainable, we're talking about well-being, we're talking about equity, equitable health, we're talking about future generations, we're talking about not breaching ecological limits. That is, I would say, the public health challenge of our age, is how are we going to bring this about? And they went on to say a healthy planet is essential to the health and well-being of current and future generations and enabling all to flourish. I think I've hopefully well established that point. So the Charter suggested 5 areas for 21st century health promotion response. I'm going to deal with the first three of those. I'm not going to deal with achieving universal health coverage or addressing the impacts of digital transformation. So I want to focus on valuing, respecting, and nurturing planet Earth and its ecosystems as the first action area. The second is designing an equitable economy. The third is developing healthy public policy for the common good. And I want to talk about what public health can do about all of that. So let's start with valuing, respecting, and nurturing planet health. And in that same speech back in December 2020, Antonio Guterres not only said that humanity is making war on nature, he also said making peace with nature is the defining task of the 21st century. It must be the top priority for everyone, everywhere. And when he says for everyone, everywhere, that includes us. That includes all of us on this call. It includes all of us working in public health in Canada and around the world. Making peace with nature is our defining task and must be the top priority. Recognizing always the equity implications of saying that. In doing that, I think we need to pay great attention to the traditional perspectives and knowledges of Indigenous people. And so I take this from the Truth and Reconciliation Commission report from a few years ago now. And they wrote about this in that report: reconciliation between Aboriginal and non-Aboriginal Canadians from an Aboriginal perspective also requires reconciliation with the natural world. If human beings resolve problems between themselves but continue to destroy the natural world, then reconciliation remains complete. And they went on to say that they had repeatedly heard that reconciliation will never occur unless we are also reconciled with the earth. So one way to understand and frame our thinking about making peace with nature is that we have to reconcile with the earth as part of our work of reconciliation with Indigenous people in Canada and around the world. It's an area I'm particularly interested in these days because I sit on a global working group for the IUHPE on Waiora Planetary Health, which very much takes an Indigenous and, for that matter, spiritual perspective on health promotion, planetary health promotion. So what does it mean if we make planetary health central to public health? Well, for starters, it should be in the curriculum for all health sciences, and in particular in health, public health and health promotion. And yet it isn't. And some work we did a few years ago has shown that. There's a lot about social determinants of health, but very little even now about the ecological determinants of health. And in fact, we need to teach the two together. So planetary health, which really integrates the health of civilization, the social determinants, if you like, and the health of the planet, that must be not in the curriculum, I would say central to the curriculum for all health sciences. We need to recognize that ecosystem and biodiversity protection and restoration in the places where we live is public health work. Just as sanitation was public health work in the 19th century. So building sewers and creating clean water, what we would now call public works, was public health work in the 19th century, as was good housing. Building codes, if you think about it, are actually public health codes. And in so many other ways, health underlies much of our, particularly our municipal bylaws and policies. So protecting nature is public health work in the 21st century. We need to promote nature contact. We need to encourage people to be out in nature. We need to encourage nature kindergartens. We need to ensure that cities are greened and have lots of parks. We need to promote prescription of exercise in nature, the parks prescription, because all of that, and we've learned this during the COVID pandemic in particular, I think, promotes mental well-being, child development, and physical activity. And I think that we need to create planetary health officers to do this work, just as we created public health inspectors, later called environmental health officers in many cases, in the 19th century and continued that through the 20th century. I'm not saying we should not have those, but in addition, we need to create what I would call planetary health officers to do this work at all levels, from the local to the national, and for that matter, to the global. So we must make planetary health central to public health. The second key strategy or action area in the Geneva Charter for Wellbeing was what I would call designing an economy fit for the 21st century. And in order to do that, we need to understand this basic truth, which comes from the Worldwide Fund for Nature's Living Planet report in 2014, and says it as well and shows it as well as anything I've ever come across. Ecosystems sustain societies that create economies. It does not work the other way around. And yet our problem is we've often got it the other way around. We think that the economic domain is the most important domain. The Minister of Finance is the most important person in government after the Premier or the Prime Minister. The budget, incidentally, the federal budget is coming down on April 7th. Which do you think we'll hear most about on April 7th? World Health Day or the federal budget, or on April 8th anyway? So we put GDP first. That's how we tend to measure success. We have put the economic domain central. That's what we talk about a lot. We actually ignore the economy's impact on both the social and the ecological domain. And in fact, we don't include often in the costs of doing business the social and economic and social and ecological costs. So we actually have this, frankly, ass backwards right now. We are going to need to invert this and recognize that ecosystems sustain societies that create economies, and that it does not work the other way around. The economy is a social construct, and we need to change it to make it fit for the 21st century. It's something I have written a great deal about. I'll come to that in a minute. But this, I think, is one of the most promising ways to think about that. This is Kate Raworth's notion in recent years of donut economics, which can be applied at all levels from the local to the global. We're currently trying to create a donut economy model for this region that I live in. And it's a very simple idea. The economy must provide a social foundation of well-being that no one should fall below. That's the inner dark circle. Inside of that, you will see water, food, health, education, income, and work, peace and justice, and so on. Essentially, the SDG goals. You have to meet those needs. At the same time, she says, there is an ecological ceiling of planetary pressure that we should not go beyond. That's the planetary boundaries. And that's the ecological ceiling, the dark green outer circle. And beyond that, you will recognize the same planetary systems as in the planetary boundaries work. She's very explicitly linking those: climate change, ocean acidification, freshwater withdrawals, and so on. So between those two, in that light green area, is what is the Planetary Boundaries model called a safe space for humanity. She calls it a safe and just space for humanity. And therefore the economy must be regenerative, it must regenerate natural systems, and it must be distributive. We are going to, in reducing our ecological footprint by 70 to 80%, redistribute that to other people who need it more than us. We also are going to have to tackle the absurdity of GDP. And this comes from the UN Secretary General's report, Our Common Agenda. And that report wrote, we know that GDP fails to account for human well-being, planetary sustainability, and non-market services and care. In other words, things like volunteering, raising your family, and so on. And it does not consider the distributional dimensions of economic activity. Absurdly, said the UN Secretary General, GDP rises when there's overfishing, cutting of forests, or burning of fossil fuels. I would add, to give you a more directly health example, that GDP rises when the tobacco industry is very active And it also rises when the health sector has to treat tobacco-related diseases. So the activities of the tobacco industry add in two different ways to GDP. What an absurd way to grow GDP. As our common agenda put it, we are destroying nature, but counting it as an increase in wealth. Clearly absurd. And so we must replace GDP. And this is what Antonio Guterres had to say in presenting our common agenda to the UN General Assembly. GDP fails to account for the incalculable social damage that may be caused by the pursuit of profit. My report calls for new metrics that value the life and well-being of the many over short-term profit for the few. Dramatic, but important words. And so we need to replace GDP with things such as the Genuine Progress Indicator, or in Canada, the Canadian Index of Wellbeing, or other alternative and much more useful measures of societal progress. We're also going to have to understand that wealth is not simply about how much money and how much stuff you have. And in Making Peace with Nature, the UN Environment Programme refers to inclusive wealth, which is the sum of produced natural, human, and social capital. Produced meaning the stuff we produce and the wealth that comes from that, the economic wealth. But in addition to economic capital, if you like, there is natural, human, and social capital. And often, sadly, the way we increase economic or produced wealth is actually by reducing natural, human, or social capital in some way. So that clearly has to change, and we have to think about wealth in a very different manner. Now, I don't have time to keep going on this topic, but those of you who are interested in this should see, for more in-depth discussion, a report from May of 2020 through the National Collaborating Centre for Healthy Public Policy on Ecological Economics and Public Health that I wrote. It was presented at an interview, but it actually is a report I wrote. The third area in the Geneva Charter that I want to explore is developing healthy public policy for the common good. And all I've done here is to present some of the policy recommendations that are recommended by WHO for World Health Day for governments to consider. These are dramatic, they're radical, and so they should be. Keep fossil fuels in the ground. Stop new fossil fuel exploration and projects, and implement policies on clean energy production and use. Our federal government definitely needs to pay attention to that, as do governments such as Alberta's and BC's and Newfoundland's and others. We can't keep expanding fossil fuel use or its development and exploration and development. We have to stop fossil fuel subsidies. All of the fossil fuel subsidies should simply be transferred to become green energy subsidies. Pretty much overnight, it's the way it has to happen. And we need to reinvest those fossil fuel subsidies in public health, repurpose agricultural subsidies towards sustainable and healthy food production. Right now, that is not the case. Implement policies to reduce food wastage, build cities with green spaces that promote physical activity and mental health, and devise policies on waste and plastic reduction. And the list goes on. I'm only giving you a sample. The website at the bottom there, or just Google WHO World Health Day, and you'll find their recommended actions. Very simple, very straightforward. These are healthy public policies, something we've been talking about now for getting on for 40 years. The first conference on healthy public policy I organized in 1984 in Toronto. It became part of the Ottawa Charter for Health Promotion in 1986. So it's not exactly a new idea, but we're not very good at doing it. We need to make public health and well-being central to governance. And other ways we can do that, we need to recognize the rights of nature and people. We need to recognize the right to a healthy environment in the Constitution. It's not currently there, it should be. And the Human Rights Commission recently recognized the right to a healthy environment globally, but it's not in our Constitution. We need to recognize the rights of nature to exist. There are examples recently from Aotearoa, New Zealand, on recognizing the right of a river, the Wanganui River, and the right of an area of land Teawara, I believe it's called, as persons. And so recognizing the right of nature to exist, very interesting ideas that we could implement here. We need to recognize the rights of future generations, and we need to recognize the rights of other species to exist. These two are healthy public policies. And finally, I want to end by talking about some governance innovations that we could undertake. And I'm going to skip through these fairly quickly, and I probably won't get time for all of them in detail, but you can read about these in the PowerPoint, which will be available following this. So at a societal level, on April 7th, World Health Day, a group of organizations to which is issuing an open letter, and CPHA is a signatory to that open letter to the first ministers, that is to say the Prime Minister and the premiers across Canada. A large number of national and other health organizations and individuals have signed on to this. Among other things, it says that we need to create a Wellbeing Society Secretariat in the Privy Council office federally or in the cabinet offices in the provinces and territories. We should pass, as they have done in Wales, a Wellbeing for Future Generations Act, and we should establish a Future Generations Commission. And again, that can be done both federally and in every province. And also federally and in every province, we should create a wellbeing budget, as they have done in Aotearoa, New Zealand. What about the health sector? Well, here are some things I think we should do. We should establish an Office for Planetary Health in the Public Health Agency of Canada. Do you know that the report of the Chief Public Health Officer in December, which was about looking at the future of public health, didn't mention planetary health, didn't mention loss of biodiversity, didn't mention, apart from in passing, it talked about climate change, otherwise didn't talk about any of this. That has to stop. It has to be recognized as a massive public health challenge. We need to establish an Office for Planetary Health in the Public Health Agency of Canada, and we need regular reports on planetary health and on the Wellbeing Society. Similarly, we need to establish the CIHR Institute on Planetary Health. When the CIHR Institute on Population and Public Health did a report about a year ago and then a follow-up report in the fall, again, planetary health barely figures in their vision of what public health needs to be doing. That also has to change. But we don't even have an Institute of Environmental Health in CIHR. That has to change. So we need an Institute on Planetary Health. And then all of the provinces could and should sign on to the WHO Net Zero Health System commitment. So Canada at COP26 signed on to WHO's Net Zero Health System commitment, but we need the provinces to sign on too. So talk to your provincial government about signing on to this. Not only that, but we should go further and aim to become a one planet health system and look at some of the work that's already going on in the Canadian Coalition for Green Healthcare, a new Cascades project, and so on. Join CAPE, the Canadian Association of Physicians for the Environment, CANE, this Canadian Association of Nurses for the Environment, the Coalition for Green Healthcare, Doctors for Planetary Health here in BC, or the Réseau d'Action pour la Santé in Quebec, de Santé Durable in Quebec. So these are some of the things that the health sector can do. And then you could take the Planetary Health Pledge. We're encouraging people across the country and around the world to take this pledge. It's available if you go to doctorsforplanetaryhealth.com under events. Take the pledge alone or with colleagues, video yourselves doing it, and post it to social media. We want to create a bit of a tidal wave of this, taking the Planetary Health Pledge, which is adapted from a much longer pledge in the Lancet by Doctors for Planetary Health here on the West Coast. And then finally, a community level change, we need to focus on creating healthy one planet communities. How do we locally reduce our ecological footprint to the equivalent of one planet while ensuring good health and a good quality of life for everyone? So the equity dimension. I'm not going to go through the details of this, which is about some local work here in Victoria and Saanich, where I live. But I would just point out that when you look at the major elements of the ecological footprint, roughly 3/4 of the food footprint is meat, fish, eggs, and dairy. Roughly 3/4 of the transport footprint is private vehicles, and roughly 3/4 of the building footprint is operating energy. So just consider the health co-benefits of a low-meat diet from a sustainable food system, which is essentially what the new Canada Health Guide pictured here represents. Consider the health co-benefits of active and public transportation, and consider the health co-benefits of clean energy for building and other uses, and much, much more besides. So think about how you do all of this at the local level. And remember that a sustainable one planet community is a healthy community. I call this Healthy Cities 2.0. And I'm going to skip over this, which is a set of principles from bioregional, but note they're all about health, equity, culture, community, happiness, local economy, very human things. There are things happening in BC, there are things happening locally. This is the work that I'm doing around conversations, but I want to bring this to a close so there's a chance to get to some of your questions and comments. Thank you for your attention. And as I said, the PowerPoint as well as the recording of this will be available to you afterwards. Thank you. Bye-bye.
Oh, thanks, Trevor. That's great. We've got quite a few questions in the Q&A, and I think there's going to be some very interesting discussion. There were also some comments made in the chat, which you actually answered during the course of your presentation. So I would like to suggest that if folks feel that they're not listed, we're not getting to what you mentioned in the chat, please take a moment, type it in the Q&A sequentially, we'll go through them. I wanted to follow up on a couple of comments that Trevor made about the action of our Public Health Association related to the challenges that we're facing with respect to the Anthropocene and planetary health. PHABC was very happily part of a legal case taken to the Supreme Court of Canada to verify that pricing pollution was constitutional, and we were successful with that. So we used legal mechanisms to address generational threats. We've also been involved with a program through the Canadian Association of Physicians for the Environment, focusing on how we can ban fossil fuel advertising. We'll be hosting a major conference in November on planetary health and making peace with the environment, which we'd welcome you all to. And I want to mention that this is a long-term commitment, focused on sustainability and the environment, looking at just recovery and the implications of that for the environment. So those are just a few examples of some of the local action, the work we've been able to undertake as an association. And I think your support for those kinds of initiatives across the country can really have an impact on decision makers and on systemic change. So let's move now into the Q&A. And Trevor, I'll just invite you to work through them systemically. Thanks, everyone.
A little easier said than done because they're quite small print, and the first one from Victoria Phillips is quite long.
Okay. Why don't I just do a quick translation for you? It's basically asking about how to deal with dependency on fossil fuels in the north, on the challenges in the remote and northern communities around dependency on moving goods and products and how to make that green, and what can the public health community do to address it. So that's a big rural, remote, northern challenges that are faced on dependent economies and what can be done to transition. Hopefully that was good, Victoria.
I'm not an expert on that, so I'm not going to be able to give you a very solid answer on that, but I do think that first off, we're not saying that no one should ever use any fossil fuels ever. What we have to get to is what's called a net zero position, which is to say that you balance off the fossil fuel emissions with mechanisms that absorb the CO2 that's emitted by one form or another. So that particularly in areas like that, it's hard to imagine, for example, right now, electric vehicles doing very well in the north, or being able to certainly drive the long distances involved and to set up the charging infrastructure and all the rest of it. I do think there have been interesting developments, from what I understand, in developing more sustainable energy systems to replace diesel generators, for example. But again, in some places, it's going to have to, we're going to have to use fossil fuels. So it's not that we shouldn't use fossil fuels at all, it's where do they make sense and how do we balance off their impact where they do make sense, but elsewhere get out of them as quickly and as much as possible. So I don't have an easy answer for you. I recognize the challenges of the North and just generally of more rural and remote communities. But there is also a lot of work I know, don't know the specifics, but I keep hearing about activities going on in those areas. I think it might be particularly interesting to think about that in terms of the health sector and how does the health sector in those areas reduce its ecological footprint, which incidentally is more than just fossil fuels. So we are also in the health sector creators of enormous volumes of waste. We use huge amounts of non-reusable products and so on. And we use a lot of toxic materials too. So we need to be thinking about all of that. Let me move on to the second. Which is from Annette, and the notion of helplessness. I think one thing that I always have told my students is it's not your job to save the world, that you can't place that responsibility on yourself, that we all have to do work. We also have to recognize one of the standard aphorisms, to my mind, of health promotion, which was Nancy Milio, who said you have to make the healthy choice the easy choice. In this case, we have to make the sustainable choice the easy choice. So when you don't make the healthy choice or the sustainable choice easy, then it's not surprising that people don't make it. So we have to look beyond what individuals can do. Although individuals are important, individuals alone are not going to turn this around. It has to be a system shift. One of my favorite quotes from the Institute for Healthcare Improvement is that every system is perfectly designed to achieve the results it gets. So currently our system is perfectly designed to inflict enormous damage on the earth while creating massive levels of inequality. If that's what the system is doing, we need to change the system, and we need to change the choices that are made available to people. Certainly there's things you can do, and as always, I think doing things with other people, doing things together, so joining some of the organizations that I mentioned, getting active locally in your community association. Here across this region, we have a number of climate action networks, which are local groups of citizens coming together to push governments. And we certainly need to push governments. So the advocacy work that Doctors for Planetary Health does, that CPHA and PHABC and CAPE and all the others do, has to be supported with energy and power, but also with money and with being involved. So get involved, even in small ways. Not everything that everybody does is going to save the world, but we can all make a small contribution. And for example, I don't recommend to the public going vegan. First of all, I'm not vegan myself, but secondly, it's too big a step, I think. But what we can do is go to a low meat diet. And if you look at the New Canada Food Guide, that's essentially a low meat sustainable diet. It fits very well with the Eat Lancet Commission on Sustainable Healthy Diets too, which came up with much the same kind of diet. So we can do those sort of simple things. Let me move on to Krishna's question. Any advice on how to get the province to sign on to the WHO Net Zero Health System commitment? You could start by writing to the minister. You might also get your health authorities to take a look at it and sign on. There's actually, there's three pieces, I think, to this. First off, what Canada signed on to is not actually, I misspoke myself, I think, is they haven't signed on to the net zero. They've signed on to a low carbon health system commitment. Now, interestingly enough, of course, Canada, federal government doesn't run our health systems. So it's the provinces that also need to sign on, but there is a second and higher bar, which is the net zero health system commitment, which 15 countries did sign on to at COP26. Canada was not one of them. So I would say, get together with your associations, with your local organizations, with your health authorities, write a letter yourself, talk to your own MLA or MP, but put some pressure on the Minister of Health in each province to sign on not only to what Canada has done, which is the low carbon health system commitment, but to also sign on to the net zero WHO commitment, which would be a step further than the federal government went. And then a third piece is, it's not just about carbon. So we have to become a one planet health system, if you like. So why not make a commitment to becoming a one planet or sustainable health system? And the UK's NHS has done a lot of work in that area that we can learn from. But also the Canadian Coalition for Green Healthcare, which I co-founded, has been doing this work for 20 or more years now. They're a huge resource that we should be using. Some health authorities are picking it up and implementing it. In Vancouver Coastal, they've established a Planetary Health office with a medical director, Andrea McNeil, who's actually a cancer surgeon in Vancouver, heading it up. There is a green care project that involves the 4 lower mainland health authorities in BC. There's a lot of work going on. So put pressure on not just to become a net zero health system, but a one planet health system. And then the final question. Yes.
Sorry, you've got quite a few there. So I'm thinking we'll have to do speed answers so that we can try and get them all in if we can.
I'm not sure we'll get them all in.
Anyway, carry on. There's one here about elder seniors and how we can look after their needs.
Well, I think it has to do with not only nature kindergarten, but nature senior care too, if you like. I mean, encouraging people to get outside and walk, but it has to be accessible. So parks, and it doesn't just have to be parks, small amounts of nature are very important. Even just seeing nature through your windows is important and has a health benefit, we know that. But engaging seniors, I mean, we have a dog. Walking the dog every day is out in nature. It also we end up chatting to lots of other dog walkers. So it's a great way to meet people too. But lots of different ways to get outside. And I think we need a sort of all ages and abilities approach to this. Gosh, I'm not sure we've got, what, 3 minutes? I think we're not going to get through all of these.
No, but I think the last one here that I'm looking at from Karen about integrated impact assessment matters. And if I can just say for Jean, there are also municipalities that are developing senior-friendly green spaces. And, yes. And I think that's a very important step. I know Saanich has been involved in that. So feel free to contact us afterwards for more details on that. But yes, Trevor, if you could speak to the utility promise of environmental strategic impact assessment. And I know this is something Dr. Takaro's been pushing very much on the TMX pipeline in British Columbia. Do you have any methods or examples that you think would be helpful for this group?
Yes, well, just very quickly on the age-friendly piece too, the WHO has an age-friendly communities program as well. So it's national, international, as well as local. Thank you for reminding me of that. On the topic of integrated assessment, it's certainly something that, for example, the Health Officers Council of BC has been calling on for some time, and a lot of other people as well. And that is, as I mentioned earlier, too often we take a very narrow view of the impact of activities. We don't look at the health impacts of, for example, pipelines, or if we do, we look at them in a very narrow sense. We look at their environmental impacts in very narrow senses. So, for example, the health impact assessment of pipelines here in BC doesn't include the health impact of the burning of that fossil fuel on public health globally. It just looks at what happens in BC. Things like that. So we need to very much expand this to, and it's actually part of the notion of inclusive wealth. So we need to look at the health impacts in an inclusive way as we need to look at the benefits in an inclusive way. And we have to take a much more aggressive approach to health impacts assessments than has been the case. We also need to be thinking about the impacts on future generations, as well as people remote from where the activity is taking place.
Trevor, we've got Helen Doyle's question about the Office of Planetary Health and PHAC and support for that, and then mentioning the focus on behavioral risk factors, but failed to include air pollution and other climate risks as chronic disease risk factors. How do we shift this focus within public health agencies? And I think, again, policy documents, position papers, and even infographics can help reframe the question. But I think that's an important one to probably end on.
Well, definitely, I think we need, not just at the federal level, but I think that the equivalent of the public health agency in each province should be doing reports on planetary health or incorporating planetary health in their population health reports every year, and understanding some of these issues and their impacts. And much more important in a sense than just their impacts is what we can do about it. The time is very short. And we're going to be blowing past 1.5 degrees centigrade quite soon if we don't change dramatically in the next few years. We're probably going to blow past 2 degrees centigrade too, the way things are going. That's the latest news from the IPCC. So this stuff is urgent, and we need to get our public health agencies on side and talking about this, and taking it to other parts of government too, not just staying within the health sector.
Okay, thank you so much. I know there was one question from Christopher Jack about development of renewables. And Chris, I'm going to suggest that we reach out to you. I think it's, it'd be great to have a more fulsome conversation about that, as it has implications for migration strategies. I want to take a moment now to thank you all for attending. I know that we've had a very short amount of time to discuss a very, very big challenge. But I do think that Trevor did a great job of framing the threats, the risks, and some very concrete examples of action that can be taken. It's been wonderful having all of you with us to celebrate Canada Public Health Week. And thank you, Trevor, for your passion, commitment, and leadership to the most important public health issue we have confronting humanity and the species of our planet, our home, and the safety and the sanctuary that it could become. So we're grateful to you. We're thankful to CPHA. Thanks so much, everyone. Don't be shy about following up with us. We look forward to hearing from you. Bye.
Thank you, everyone. Bye.